It's a new month. Happy to welcome many of you back. I see some familiar faces and see some new folks here as well. My name is Lisa Asari, and I will be one of the hub leads today. I'll be helping to facilitate this session. Really exciting session today. We'll be talking about vaccines, what we know so far and what we could share with you. So as I mentioned, I'm Lisa Asari from the New Jersey Department of Health, and I'll be joined with some other members of the Hub family team. And at this time, I'll ask them to introduce themselves. Dee, I think you're on mute.
It's not allowing us to unmute.
Oh, thank you. Good afternoon, everyone. My name is Dee Reed. I'm a program management officer on the maternal child health team, and I'm happy that everyone is here today despite the snow. So it's going to be a good session, so welcome.
Hi, I'm Marie Kinsella. I'm the Director of Community Programs for the Partnership of Maternal and Child Health of Northern New Jersey.
Hi, everyone. My name is Brandy Wooding. I'm a nurse consultant for the Maternal Care Quality Collaborative out of New Jersey Department of Health. Happy to see everyone.
At this time, I'll hand it back to part of the ECHO team, which is the Rutgers folks, and Ashley Figueroa, to give us just a few program reminders and tips before we get started. Thanks, Ashley.
No problem. Good afternoon, everyone. My name is Ashley, and I am the program administrator for the Maternal Child Health and Pediatric Echoes here at Rutgers, Project ECHO. So before we get started on today's session, I just wanted to go through some few reminders. We encourage you to attend all the sessions in this cohort. And during one of these sessions, we welcome you to submit your questions for the hub presenters and upcoming presenters. So please use your video if you're able to do so. You may ask or offer your questions or recommendations anytime during the session by using the chat box and also speaking during the Q&A. So please keep your eyes peeled on the chat box throughout the session, since we'll be sharing links to session resources, the post-session survey, as well as the Q&A poll submission. Given the increased usage of Zoom around the world, we want to ensure that you feel comfortable within our community. Our purpose is to ensure a safe and collaborative space for our participants. So a few things that you will help us is to change your screen name to display your name so we're able to identify you, and let us know via the chat what's your name and where you're coming from. If there's anything you see or hear during this call that may feel inappropriate, please let us know. Once you register for the selected clinic, you are registered for the entire series, so there's no need to register for every single session. Some guidelines: please always remember to be HIPAA compliant. Please stay muted when not speaking, and when you do speak, please introduce yourself first. Be respectful of one another. If you've missed the live CHW ECHO session and you're watching this at a later time and you're interested in receiving credit for the CLG Community Health Workers Institute, please reach out to the Rutgers Project ECHO team to fill out your post-session survey. And just a friendly reminder, you will need to fill out a post-session survey for each session attended in order to receive credit. Thank you.
Thanks so much, Ashley, for those program reminders. Just to level set a bit, for anybody that's new to ECHO, this is a platform that we've chosen to really share information with you on. Certainly through the COVID pandemic, nothing stays the same. Things are constantly changing, and we feel that this has been an ideal platform to really create this community of frontline workers and really share information with you as it is emerging. Like I said, this is our 6th session. We've been together for quite some time, since November. We've covered COVID basics, childcare, food security, employer and worker rights, as well as mental health issues. But it's today that we added an additional session to really talk about vaccines, what we know to date. So I often sort of just look to frame the sessions, and I'll just speak a little bit about just that there's been a lot of misinformation out there about the virus, a lot of political polarization about how to stem its spread, in addition to fear and mistrust by certain segments of the population based in a history. And all of that has really led to this mixed willingness about being vaccinated. Today, we're here to give you information. It is the ECHO ECHO spirit to be all teach, all learn. And that's what we will do today. So there's no question that you shouldn't ask. Please certainly use the chat box as things come to mind and just tell us what you think or what you would like to know more about. In terms of vaccinations in this vaccine session today, the messenger matters. It really matters who we get information from. So we are fortunate today to have two esteemed colleagues, Dr. Meg Fisher and Dr. Denise Rogers, who will share with us. But the message also matters. And I say that because you are part of the community that has been with us for several months. You are the frontline workers. You are the community health workers. You are influential in your own communities. You are trusted sources of information. So we want to make sure that we answer your questions and give you the information that you will need to serve other people. So you will have opportunities to ask questions so that you can inform yourselves and so that you can also in turn inform those that you work with. So we'll be talking about COVID-19 vaccine, the facts as we know them. Today is February the 1st, so these are the facts that we know as of right now, understanding that this is an emerging and changing area. So before we get started with our panelists, we have a special video that I'll ask Ashley to share with you now. And following the video, you will hear directly from Drs. Rogers and Dr. Fisher. Thank you.
Hello, everybody. Governor Phil Murphy here. Welcome and thank you for being part of this important RU Project ECHO discussion with Dr. Denise Rogers and Dr. Marge Fisher. Project ECHO's model of unleashing the power of collaboration and partnership to ensure a healthier New Jersey, especially for our underserved communities, has never been needed more than right now. The COVID-19 pandemic has ravaged our state, and it has laid bare the inequities in our society, including in the ability of all of our communities to have access to preventative medical care. We have 2 proven vaccines against COVID-19, with more expected to join. Our job now is to ensure an equitable vaccination program that reaches deep into every community. But we also know an important part of that job is pushing back hard against misinformation or cynicism in some corners of our communities. We must build at all costs trust, not just in vaccines, but in getting vaccinated. That's what makes today's discussion so vital and important. We have fought this pandemic using science and facts with honesty and forthrightness. That's gotten us through some dark days together. And it is what is going to push us to the new day that awaits. And with your help, we're going to get to that day together. So thank you again for being part of RU Project ECHO today. And thank you all for all that you are doing to protect our communities through these unprecedented times up and down our state. Thank you all, and God bless you all.
I'm now going to share my screen, so give me just a second, please.
Dr. Rogers, did we want to launch the poll before we jump into the presentation?
Absolutely. Thank you for that.
No problem. So we'll be sharing a poll, which you are actually able to answer in live time. And it's some questions to kind of see where you are, in regards to the COVID vaccination. So we'll leave up the questions one by one. And if you could just click through the prompts to answer. And if you're not able to do so on the I'm going to relaunch this poll really quickly because it closed down really quick on us. But if you're not able to answer on the poll, please do so now. The question is, are you planning on taking the COVID-19 vaccine? So you can answer yes or no into the chat as well. And we can give another 10 seconds. So if you haven't done so, please cast your vote. We'll be closing the first polling question. Are you planning on taking the COVID-19 vaccine? All right, we're going to share the results. And these are anonymous submissions. So I just want to take this back to the hub. If there's any questions or any remarks you want to make in regards to the results of the first poll.
I'll just say that it's encouraging to see the majority of folks being willing to take the vaccine. So thank you for sharing.
All right, we're going to launch our second poll question. So where do you get most of your information regarding the COVID-19 vaccine? If you're not able to vote in live time, please submit it in the chat box. We included news outlets or TV, radio, social media platforms, including Facebook or Twitter, etc., word of mouth, or other. And thank you all for casting your votes. If you haven't done so, please do so, or you can include it in the chat box. Give this about another 10 seconds. All right, and we'll close the poll now. Thank you. And I'll share these results with the group. All right, we can jump into our next question, which is question number 3. If you are hesitant on getting the COVID-19 vaccine, why so? Develop too fast, do not trust the research, mistrust in government, worried about the mRNA effects on genetics, long-term side effects, or other. This is great. Thank you everyone for participating and taking the time to fill out these questions. Leave it open for another 10 seconds. See a couple last minute votes coming in. All right, and now we can share our results for this. All right, we'll jump right into our next one. There's no remarks or comments from the hub. And we'll go into our fourth question. Have you heard that one vaccine is better than the other? Yes, no, or unsure? We can close this out in 10 seconds. So have you heard that one vaccine is better than the other? Yes, no, or unsure? The two vaccines being Pfizer or Moderna. All right, we'll end this poll and we'll share our results with everyone. And we'll go into our next poll question. Thank you all so much for taking the time to answer these. So our next poll question, is there anything that would make you feel more comfortable with getting the vaccine? Yes, no, or unsure? And please feel free to share through the chat box your comments or your answers. All right, so we'll end this and then we'll share our results. And then I believe we have 2 more questions to go. One more question. All right. Have you experienced any barriers related to getting the vaccine? So last question, have you experienced any barriers related to getting the COVID-19 vaccine? Yes, no, or unsure? Give it another 5 seconds and then we can close out this poll. Thank you all for participating and casting your votes. This is very helpful. And there are the sharing poll results for the last question. All right, and we will stop there. Thank you again, everyone, for participating. Dr. Rogers, we can jump into our presentation for today.
Okay. Now we will see if this will work, and I will share my screen. And hopefully you're all able to see the slides. Is that correct? All right, Dr. Fisher, I'll turn it over to you.
Thanks, Denise, and thank you all for inviting us to do this. I'm really pleased to be here, and I'm also very happy that Lisa really already gave you what is my usual disclaimer, and that is that things are changing so quickly. We are every day, sometimes every hour, getting more information and new information about COVID-19 and about the vaccines. So keep in mind that what we're saying is the facts as we know them today. That might change by the end of the day, by the end of the week, and certainly by the end of the month. So with that disclaimer, may I have the next slide? Let's just start with thinking a little bit about the disease, and I believe you're all very aware of this. The symptoms are very much like any respiratory infection, a lot like the flu: fever, cough, shortness of breath, sore throat, chills, shaking, muscle pain, headache, nausea, vomiting, diarrhea, and stuffy or runny nose. So you couldn't really tell that from any respiratory illness. But the one that's a little unique is the new loss of taste or smell. And this appears to be relatively common with COVID-19 and much less common with other viruses. Now, since these are the symptoms, and remember, we now know that many people have no symptoms at all. So when should you get medical help? Well, you definitely want to get to a doctor if you have difficulty breathing, high fever, other unusual or concerning symptoms. You know yourself best. If you're concerned, call your healthcare provider right away and get some reassurance. Next slide, please. So we're going to talk a lot about the vaccine today, but remember, there are important things that you can already be doing and should continue to do to prevent COVID-19. And this, again, is much like preventing any respiratory illness. So why do we stay 6 feet away from other people? Why do we keep this physical distance? Well, the reason is that this virus, along with many others, is spread by droplets. Droplets are what's produced as we talk, sing, shout, cough, those little spit things that get away from our mouth. Now, if we wear a mask, we keep those droplets from going out into the air. But if we don't have a mask out, those droplets can go out into the air, and most of them, the vast majority, will fall to the ground within 3 to 6 feet. So that's the reason to keep that 6 feet away. Wash your hands. Wash your hands all the time. Keep them clean. You can use hand sanitizer if you don't have soap and water available. And stay home if you don't feel well. Stay home if you're sick. Don't spread whatever disease you might have to others. If it turns out you do have COVID-19, we want you to isolate yourself for at least 10 days. And that's 10 days from the onset of symptoms, and it has to be at least a day with no fever and no medicine, and your symptoms should be much better. So 10 days for people who actually have the disease. And it doesn't hurt. If you think you have the disease and you can't get diagnosis, stay home, keep away from other people. Try not to touch your face. Now, one of the things the masks do is it makes it harder for us to touch our nose and our mouth. So masks are, again, a good way to keep your hands off your face. Avoid sick people as much as you can, and clean and disinfect. We know that the virus can drop to a surface, so keep those surfaces around you clean. Now, if you have underlying diseases, be sure you talk to your doctor, talk to your family, make a plan in advance of what you're going to do if you get sick. Next one, please. This is a great app that's available to everyone. I hope many of you already have it. You just download the COVID Alert New Jersey app. And what this does is it will tell you every day what's happening in New Jersey, how many cases, what are the statistics, and it also allows you to find out if you have actually been near someone who tested positive for COVID-19. So please download that app. It's very easy to do. Check in every day. Let us know how you're doing. Next one, please. Now, these are the frequently asked questions that are present on the New Jersey COVID-19 hub. And these are changed up every few days to make sure that we're trying to get the questions that are out there most often. So quickly, will the coronavirus survive refrigerator or freezer? Yeah, they do very well at cold temperatures. However, microwaves will kill this virus. Is the virus airborne? It can become airborne, but mostly it's by those droplets. So those droplets that go through the air for just a few feet, but there are what we call super spreader events where the virus actually gets up into the air and can be transmitted for fairly long distances. Again, you can protect yourself by wearing that mask. We're going to talk about the diseases and deaths on the next couple slides. Do you get immunity if you've had the virus? And in fact, yes, you do. We know that that immunity is good for at least 3 months and probably longer. Probably you're going to be immune for 6 or 7 or 9 months, but we don't know for sure exactly how long, and we don't know if some people are immune for longer than others. Likely that was true because that's true for almost everything you can think of. Which body fluids spread the infection? Mainly those droplets, but the virus is also present in stool, but we don't know how important stool is in virus transmission. Next one, please. Now, here are the laboratory confirmed cases as of last week. And you can see, looking at the counties, the northern counties have been more likely to have infection, a little less in the central counties, and even less in the southern counties. Now, the really nice, very hopeful thing about this graph is look at that chart. You can see that we had a peak of disease way back in March and April. Then we had a pretty quiet time over the summer. Then we started to go up in the fall. And look at what's happening now. We had a couple ups and downs, probably related to holidays, but now it looks like we really have a downslope that's continuing to drop. And that's very good news for us. But look at the total number of positives, over 500,000. Next slide, please. As far as deaths go, the deaths we saw the peak of the deaths during March and April. And then again, very quiet over the summer. And again, it increased recently. And we've seen a total of almost 20,000 deaths in New Jersey. And we're still continuing to see deaths. But again, that number does appear to be dropping. Next slide, please. With this, I'm going to turn it back over to Dr. Rogers.
Thank you. So one of the things we have to recognize is that the slides that show the overall data don't tell, however, the complete picture of what's happening in New Jersey. So if you look at this data, which this original slide is from November 25th, 2020, what we see is that Hispanic and African-American people are more likely to be infected with COVID, they're more likely to be hospitalized, and they're more likely to die when you do an age adjustment. And what that means is when you essentially look at the population in terms of years of potential life. That's what age adjustment is all about. And so we know in the spring, when we had the first outbreak, that there were a significant number of people who died who were living in nursing homes. And the majority of those people were white. And so what we know is it's skewed toward looking like the vast majority of people who died were white, but that also it covered the fact that it's younger Black and Hispanic people who are more likely to die from this disease. What we see here with the updated data from just last month is that this trend is continuing, and it's becoming even clearer that people in the Latinx community are even more likely to be diagnosed with COVID, still more likely to be hospitalized, and more likely to die, as are African Americans in the state. It is important for me to note that this is not a phenomenon that is unique to New Jersey. In fact, there is evidence of this racial disparity in COVID deaths throughout the entire country, throughout the United States. This is a slide that attempts to give you a sense of what this disparity actually looks like in a particular age group. So if you look at that blue bar, it basically is a ratio of comparing whites to whites. And so it's at 1.0. When you compare Blacks to whites in terms of the death rate, you see in the 35 to 44-year-old age group, the ratio is 10 to 1. So African Americans are 10 times more likely in that age group to die from COVID than their white counterparts. For Hispanic people, it's an 8 to 1 ratio in that age group. And so again, this is another way of showing you that disproportionately people of color are dying from COVID at younger ages. It's also clear from some work that's being done by the Kaiser Health Network as well as the Guardian that a significant number of healthcare workers have died from COVID, and that the majority of those are African American and Latinx people. These are some of the faces of our healthcare colleagues who have died from this disease. When that report first came out, it was estimated that there were approximately 900 healthcare workers. The report was subsequently updated in August, showing that close to 1,500 healthcare workers had died. And in a subsequent update, we see that the numbers are closer to 3,200 healthcare workers, again, predominantly Black and brown people dying from this disease. Dr. Fisher, I'm going to turn it back over to you.
Thanks. We're really now going to talk about the vaccines. And in order to understand how vaccines work, we have to start with a little bit about the immune system and how our immune system protects us. So if we think about our immune system, it's the white cells that have a lot to do with protecting us. So the white blood cells, they go throughout our body and they help us. These cells, there are several different of them that are important. The macrophages are these little cells that sort of sit around and they look for things that don't belong and they swallow them up. They also take care of any dead or dying cells. Now, not only do the macrophages swallow these up, but they also process the germs. They process them so that they can present them to the B cells and the T cells to tell the B and the T cells, get to work, make a response against this antigen. The B cells make the immune globulin, IgG, IgM, IgA, IgD, IgE, and the T cells, they are the cellular immune mechanism. So those are cells that get revved up and actually go out and destroy virus-infected cells. So all of these are important to our immune system. The first time you're infected with COVID, your B cells, your T cells get to work. It's going to take them a couple weeks to really mount that response, but then that will protect you when you are next exposed. Now, what we'd really like to do is we don't want you to have to get infected with the virus to be protected. We would like to give you a vaccine that will do the same thing and that will protect you. Next slide, please. So this is a very nice YouTube about the laboratory that developed the COVID-19 vaccine. And when you have time, it's pretty short, it's about 15 minutes, and it really is a very neat, quick way to learn about vaccine development and about messenger RNA vaccines. Next one. So we have lots of coronaviruses that have been circulating for decades, for probably millennia. And the first four that are listed here are the ones that are common cold viruses. They've been around for a long time. We've known about them a lot. Most children will get these at some point during their childhood. Adults are a little less likely to get them because they already had them as when they were a child. But then we have these other human coronaviruses. These are viruses that have made probably a leap from the bats to people, sometimes with other animals in between, and they cause these outbreaks, these epidemics. The first one that was that we know about is the SARS-CoV virus, and it caused SARS, severe adult respiratory syndrome, and that occurred back in 2003. It spread to many countries, and then by 2004, it went away. In 2013, the MERS virus came up, and this seemed to be related to camels and bats, and it was on the Arabian Peninsula, and there still are occasional cases of this MERS coronavirus. And then, of course, as you all know, last December, not this past December, but December 2019, the SARS-CoV-2 virus emerged, again, probably from the bats, but possibly from animal reservoirs, and it began to be transmitted among humans and has caused all the disease we're seeing now. Next slide. So how did the COVID-19 vaccines work that we currently have? Well, these vaccines really want us to make antibody without having to get sick. So the current vaccines are messenger RNA vaccines. And what they do is they have the genetic material, they have the code, not the nucleus of the cell, but the viral code to make the little spikes that sit on the outside of the coronavirus. And that little code is encircled in a little bit of fat, a nanoparticle of lipid, and that, when it's injected into your arm, gets into your cells, and that messenger RNA tells your cells, make a little of this spike protein, and then the spike protein gets out of the cell or is expressed on the outside of the cell, And that tells the B cells and those T cells that we talked about before, all right, it's time. This is not right. This spike protein shouldn't be here. Make antibody against it so that you will be prevented from getting COVID-19 if you're actually exposed to the virus. Next one. So here's some facts about messenger RNA vaccines. You can't get COVID-19 from the vaccine. It's just a little bit of messenger RNA inside a lipid coat. It can't give you COVID-19. And that messenger RNA only stays in your body for about 6 hours to 24 hours. It's not there for very long. It's degraded and it's gone. So they don't affect your DNA. Now, our DNA is inside of the nucleus of our cells. And this messenger RNA can't get into the nucleus of the cells. And it can't be read to change the nucleus of our cells. So it can't change our genetic material in any way at all. Next one. So this is the spike protein that I was talking about. Those red things are the spike. And what we want to do is make antibody against those spikes so that that virus can't get into us and make us sick. Next slide, please. So what side effects are you going to get? Well, we said this messenger RNA is going to turn on your immune system. So the side effects that you see are really the same side effects that you get when your immune system is turned on. So fever, aches, pains, fatigue, malaise, those kinds of things are the common side effects. And of course, it's a shot, so it will hurt when you get the shot. These usually start within a day of getting the vaccine, and they last for about a day to 2 days, but they shouldn't last for longer than that. Remember that there's 2 doses for both the Moderna and the Pfizer vaccine. For the Pfizer vaccine, the second dose is at 3 weeks, Moderna at 4 weeks. And it turns out that side effects are actually a little more likely after those second doses. Now, for people who have gray hair like I do, the good news is that side effects are less common in people who are older. So over 55, that young age, you're less likely to have side effects, more likely when you're younger, but that just may mean that your immune system is working better. The side effects really don't differ much between the Pfizer and the Moderna. And it's important to remember that we're continue to look for any side effects, any unexpected side effects. So the safety that these vaccines have already gone through, it continues. Safety monitoring will continue as long as we have these vaccines. So we're looking to be sure there aren't other unexpected or rare events that are due to the vaccine. We do know that these vaccines can cause allergic reactions, and we are concerned about that, but these allergic reactions are very uncommon. Next one. So why do they have more noticeable side effects than the flu vaccine? Well, I think it depends who you talk to. Many people think it's about the same as the side effect was for the flu one. And they compare a lot with side effects from like the shingles vaccine. And actually for that one, a lot of people had much more in the way of pain. So it really depends on your individual immune system and how you react. And they really are a sign that your immune system is working. Some vaccines have more reactions than others. We know for the younger children, the pertussis vaccine has always been a little bit more likely to cause side effects. But these reactions are a small price to pay to prevent the disease. Side effects can be more pronounced in some people than others, but not necessarily in people who have other risk factors. So in fact, it's not more common in older people, and it's not necessarily more common in people who have other problems like high blood pressure, heart disease, etc. And do children get the side effects? Well, children haven't yet been tested with the vaccine. We are just currently doing studies to look at children down to age 12. As you know, the Pfizer vaccine is for children at age 16 and up, and the Moderna for 18 and up. So for children 16 to 18, their side effects are pretty much the same as adults, but there really were not a lot of those children in the trials. Next one. So this is the allergy information. So the weekly morbidity and mortality weekly report has reported on anaphylaxis, this problem with severe allergic reactions following the Pfizer vaccine. They reported on that first, and recently also reported on side effects with the Moderna vaccine. But again, this is a side effect that can happen with any vaccine, but fortunately it's very rare, and really fortunately it's treatable. It's treatable with an EpiPen, so that for people who have allergies, who have had allergies to other things, be sure you tell the people when you get vaccinated and have your EpiPen with you, as you're supposed to have all the time. The next slide, and I think we go back to you, Dr. Rogers.
Thank you, Dr. Fisher. So I want to spend a little bit of time talking about some of the reasons that there's vaccine hesitancy in particularly African American and Latinx communities. One of the reasons for this hesitancy is a mistrust in the overall research community as well as in the healthcare community due to some very flagrant abuses from the past. The most famous of these is the Tuskegee study of untreated syphilis in the Negro male. Many people are under the impression that in this study, African American men were actually given syphilis and then not treated. It's important to note that the study did not infect any men. What the study did was it took men who were already infected with syphilis, syphilis being a fairly common disease in the early part of the 20th century, and it didn't treat these men. Now, when the study began in 1932, there was no treatment for syphilis. However, in the early 1940s, penicillin came around and other antibiotics that would treat syphilis, and these men were not given the appropriate treatment because the researchers wanted to continue their study to see what the long-term effect would be. So clearly a highly unethical, totally inappropriate study was done that has carried a lasting impact on communities of color, along with other studies that have been abusive, leading us to see some of the problems that we see today. However, I have to say, as an African American physician, I believe that if we're going to talk about the bad, it's imperative that we also talk about the good. And there's several highlights, and this list is in no way exhaustive, that I want to remind us of. So it was an African American man, Dr. Charles Drew, who was the person who pioneered large-scale blood banking. And blood banks transformed our ability to save the lives of people who were injured through accidents and were at risk of dying from bleeding to death. It transformed our ability to do surgeries over time. And this finding was done by an African American physician. I never talk about African Americans who made significant contributions to medicine without talking about my friend and mentor, Dr. Marilyn Gaston, who led the team that found in the 1980s that if children with sickle cell anemia were treated preventatively with penicillin, it would significantly reduce the number of infections that these children got, and it led to a significantly prolonged life expectancy. It was this study, prophylaxis with oral penicillin in children with sickle cell anemia, that actually changed our national policy and caused us to screen all newborns for sickle cell so that they could be appropriately treated as early as 3 months of age. And again, Dr. Gaston played a major role in this study and in further work in sickle cell anemia. And so following in that legacy, we have to talk about Kizzmekia Corbett, who was one of the major scientists involved in the creation of the Moderna vaccine as well. And so again, if we're going to think about the bad, we also have to think about the good and the wonderful African American and Latino scientists that are now involved in healthcare, in discovery, and understand that there are also protections that have been put into place in order to help prevent some of the terrible kinds of abuses that occurred with things like Tuskegee. And so when each of us thinks about whether or not we're going to take this vaccine, I often refer back to the wise and wonderful Maya Angelou, who tells us that courage is the most important of all virtues, because without courage, you can't practice any other virtue consistently. You can practice any virtue erratically, but nothing consistently without courage. And for many of us, it will take courage for us to take this vaccine, in part because there are some fundamental questions we still have. Some of you are going to ask us, how long will the immunity from the vaccine last? We don't yet know. There are some things that we do know, and I want to reinforce some of what Dr. Fisher says. We know that the mRNA degrades quickly in your body and will not have any impact whatsoever on your DNA or get into the nucleus of your cell. But again, what we don't know is, will this vaccine protect us from every variant that may come along? We have some evidence that the vaccine seems to be effective with the South African and the British variants, but the longer this disease remains in the population, the greater the risk there are for the development of more variants. And so there may come a time when we will need booster vaccines because the current vaccines won't cover those variants. So I can't tell you today that I know for sure that all of the variants that may come down the pike will be covered by this vaccine. And so for that reason, we are called upon to take that courageous leap of faith to say this vaccine is important. And it's important not only for us, but is important for us as we each play our role in creating a beloved community. And I refer to it as a beloved community because I want us to think about the fact that yes, we are going to do this, some of us for our children, some of us are going to do this to protect our parents, some of us are going to do this to protect other family members that we care deeply about. But we want to move to a space where we also do this because we care about the greater good, that we actually want to help create a world. And I have to admit, it's even harder in our current environment to aspire to this, but aspire we must. We must aspire to a world where we do things because we care about each other, even when we don't necessarily know each other. And lastly, I have to say, what is all our alternative? So if we don't get immunity, widespread immunity to COVID, we will never go back to those really important moments in our lives when we are able to hug our family members, when we are able to send our kids back to school without fear, when we are able to go back into the workplace, when we are able to be with those that we love when they are in the hospital with grave illnesses and perhaps at the end of our lives. This vaccine is our hope to be able to get back to some sense of normalcy in our lives, but we never actually want to go back completely to the old ways because we want to be reminded of what COVID has shown us about the adverse impact of poverty and the adverse impact of discrimination. And so as we move forward, being a better protected from COVID world, let us also try to create a world where we are better protected from poverty and racism and many of the other ills in our society. And on that note, I will close and we can open it up.
Thank you so much, Dr. Rogers and Dr. Fisher. You know, very, very informative, very comprehensive. People are writing in the chat, excellent presentation, scientific and compassionate, because I think you really brought the human side to this work. And I really have to say personally, I appreciate both sides of the story. You know, there's reservation and hesitation about research, but research has also pushed us and sort of brought us to this place. And it's wonderful to see the scientists across the board. So at this time, this is the time for questions. There are several in the chat box. I will ask Dee to start to read them out. And certainly folks, as you feel led, please unmute yourselves and ask questions as well.
Okay, yes, there are many, many questions in the chat. So I will start with the ones, let's see, I've been writing them down. So what is an approximate time frame of immunity after getting vaccinated?
Great question. You begin to make that antibody right away, but it takes about 2 weeks before you're really going to see much in the way of protection. So if we look at the studies where they look to see when were people protected, it's about 2 weeks after that first dose. But to get the full protection, to get up to that 95 to 94% protection, you have to have 2 doses, and it's 2 weeks after that second dose. You're muted, Dee.
Dee, you're on mute.
Okay, have people been tested? Has the vaccine been tested on people with autoimmune or autoinflammatory disease?
Yes, it has. Certainly, that's not the majority of the people who were tested, but it's been tested in people who have no problems, and people who have some autoimmune problems, and people who had cancer, and people who had high blood pressure. So a whole variety of different people were enrolled in these trials because the companies realized these were going to be important questions to know. You know, in the past, we just tested it in people with no medical problems. This time, we really tried to get a much better feel for how well the vaccine would work in actual practice. So yes, it has been tested in all those groups. Now, it's not every single person. So a person who's getting cancer chemotherapy, we don't know exactly for each specific individual, will you or won't you respond? So if you have any questions at all, that's something you should talk to your healthcare provider about.
I think that one thing I wanted to add, Dr. Fisher, to what you said as well, is that we're also getting accumulated knowledge from the vaccines that are currently going on right now. And so there are people with autoimmune diseases and chronic illnesses who are being vaccinated. And there's a system in place in this country that when people have bad reactions to vaccines, they get reported at the federal level so that we can continue to learn. And the good news is we're not seeing evidence that those people are having bad reactions. So the more we vaccinate people, the more we're learning as well, in addition to those earlier studies that were also being done.
Great point. And if you get the vaccine now, the Centers for Disease Control and Prevention will ask you to download their app called vSafe. And vSafe will actually send you a text message every day for a few days and then every week to see what kind of side effects you're having. So we're getting way more information on this vaccine than we frequently do for years with other vaccines. And that information is being looked at literally every day, every week, to be sure that there are not any kind of safety concerns or red flags that would make us, slow down and say, is it really okay? So far, so good.
Okay. If you get the vaccine and have no side effects, does that mean you have less protection?
You know, I always say the side effects means your immune system's working. Some of us, our immune systems work even though we don't have side effects. So no, it doesn't mean if you are lucky enough not to have side effects, don't worry about that. You are still going to be protected.
Okay.
One question that
Oh, go ahead.
I'll read out that I've heard a lot about is I've been encouraging my Black, Brown, and Indigenous clients to get the vaccine. The trouble I'm finding is that some would like to wait until there's the one-shot vaccine. So what would you recommend if somebody was able to get an appointment for the 2 shots? Should they forego that appointment to wait for this Johnson & Johnson one-shot vaccine?
Absolutely not. And there are 2 reasons why it's absolutely not. First of all, if you're lucky enough to get an appointment, please go and get the
Take it.
vaccine and make sure you get both doses. The second is the Johnson & Johnson vaccine, while it is effective, and so I don't want to imply at all that it's not effective, it doesn't appear to be quite as effective as the Moderna and the Pfizer vaccine. But I'm going to say another reason why I think you should not wait. Because the Johnson & Johnson vaccine is one shot and it doesn't have the same requirements for storage that certainly Pfizer and to a lesser extent Moderna have, we need to reserve that vaccine to some extent for those, for example, in the third world, where they're not going to have access to the technology that's required to utilize these vaccines. But I'm also going to talk about our own backyard. So I chair the Homelessness Commission in Newark. And while we're busy trying to actually get folks to get the 2-shot vaccine, the one-shot Johnson & Johnson is also much more appropriate for very vulnerable populations where it's going to be much harder for them to come back for that second visit. And so to the extent to which you are a person who's quite capable of showing up for an appointment twice to get that vaccine, please, please do so, understanding that we have a larger both local as well as global picture in terms of how we think about the distribution of these vaccines throughout our country and the world.
Thank you for that answer, and just putting it in the context of, you said, the global village that we live in, that our actions certainly impact what happens to people in our midst. Dee, next question.
Actually, we have someone with their hand up, Lorena Oregon. Do you want to go ahead and unmute yourself and ask your question?
Okay. My question, 2 questions, is what happened if when you have the first doses of vaccine, if you cannot do it in those 28 days and you have a few days after, what's going to happen with it? The other question is to Ms. Fisher and Ms. Roger. Don't you think that if we all follow the rules, close every frontier, every boundary, and follow the rules and close it for a few weeks, this pandemic can be controlled? Like Virgin Island, I got an example. Virgin Island, Australia, they close, no out, no in, and Virgin Island only has 7 cases, was controlled right away, and Australia have down to 0, open up again, have a case again, and close it again, and get it under control again. So don't you think that if every country do the same thing, we can maybe eliminate this pandemic?
Meg, you take part 1, I'll take part 2. How about that?
Okay, I wish that were the case. I wish we could eliminate this pandemic by simply closing the borders. First of all, it's not so easy to close borders. But second of all, we know we've seen the variant strains pop up here in the United States by people who aren't traveling, who haven't traveled. We know that this virus mutates. It's already here. It's probably not going to go away on its own, or even if it is going to go away on its own, we can make it go away a lot quicker if we get people vaccinated. And that's going to take a big effort. We need probably 80% of people vaccinated in order to get this herd immunity that we want to get. But I don't think we're going to see that happen from closing borders. And if we look at from the World Health Organization, if we look at all of diseases over time, there's actually not been a case where closing borders was actually the answer to controlling diseases. But I'm also interested in what Dr. Rogers has to say.
Well, Dr. Fisher, I want to make sure we get to her first question, which is if you're a little delayed in getting your second dose.
Oh, yeah.
Yeah.
Oh, sorry, that's the one I should have taken. I should have given you the other one.
No.
Okay, so delay, no problem. So the problem is we don't want you to get it too soon, but if it's a little bit late, that is not a problem. We would prefer that you get it on the schedule, but a few days, actually a few weeks, and maybe even a few months don't matter. So we don't want it too close together, but if it's further apart, that will still protect you.
I just want to follow up a little bit on the issue of closing the borders. So there are some estimates actually that if we were to just let COVID run rampant and get natural herd immunity, as some in government have actually proposed, we would do that. It could be done, but we would lose 2 to 3 million people from this disease. 2 to 3 million people would die, let alone the number of people we would then have millions and millions of people who have long-term effects, even though it's a relatively small percentage of people now. The big problem we have in the United States, though, is we can't come to a common set of facts. And so if you look at places like New Zealand, like Australia, like South Korea, the Virgin Islands, people to a greater extent actually have created beloved community, because people are willing to say, I'm going to do the right thing, not only to help myself, but to help the country as a whole. We are so far from that. It is not conceivable. We can't even get everybody to wear a mask in this country. Are you kidding? And so it is completely inconceivable that we could ever just close our borders and have it go away. What you are allowing me, though, to and reminding me of is that the other thing we don't know about this vaccine is whether it prevents you, once you've been vaccinated, from spreading the virus. So we know that if you get exposed to COVID, particularly with Moderna and Pfizer, you're not going to get sick, but you could still have the virus in your nose or in your throat. And so it is critically important that all of us wear a mask all the time when you're outside, when you're coming into indoors, coming into contact with people who are not in your immediate household. We must wear a mask. And the truth of the matter is, the scientists tell us that if we were to be incredibly rigorous in everybody wearing a mask, and oh, by the way, wearing it properly, so it's covering your nose and your mouth and not just your chin, which makes me crazy, the number of people who just have masks on the chin, that we could actually significantly reduce transmission while we are increasing the number of people vaccinated. So again, even though you're vaccinated, you need to wear a mask just like you did before. You need to hand wash, do all of that other good stuff. But we're not going to make this go away with closed borders in the United States.
Okay, great. Susan Lattimore has a question. Susan, you want to unmute yourself?
Yeah, I have a question for both Dr. Fisher and Dr. Rogers. Dr. Fisher, with the mutation of the virus in South Africa and Brazil, now in the United States, what is the vaccine protocol going to be once that becomes the majority strain of the virus? Because as I understand it, it is highly contagious, and we don't know for sure whether or not Moderna or the AstraZeneca vaccine is going to be able to control it.
So it really depends which variant becomes the problem. The good news is that both the Pfizer and the Moderna vaccine work very well against the British the variant, and I hate calling them by countries, but that one that was kind of the first one that got a name for itself. Unfortunately, the virus that originated in South Africa is not as well protected by Moderna vaccine. We don't know for sure about Pfizer. So one of the things that Moderna has done is they are already working on a booster shot that would increase the protection specifically against the variants that are escaping, that are changing that spike protein a little bit too much. So Moderna is likely to have a booster dose that would be effective against those variants if they become predominant in this country. If, on the other hand, the California variant or some of the other variants that are around become predominant, we're okay. The Pfizer and the Moderna vaccine will work against those. Now the big problem is ensuring that we get enough people vaccinated. And one of the reasons to do this urgently is we'd like to get people protected so there's not as much virus out there and there's not as likelihood of more variants emerging. But it is the nature of respiratory viruses to change a little bit over time. And sometimes those variants, it doesn't make a big difference. And sometimes there's a major shift and it does make a difference.
Right. And my question to Dr. Rogers is, your presentation was wonderful. And I was wondering, I love the part where you were talking about the contributions that our research scientists in the minority community have done. I was wondering if we could do that as a PSA aimed towards the minority community so that they are a little bit more comfortable in coming in and getting their vaccines. We have to educate them in order for them to come to understanding that we're here to help.
I like that idea a lot. And since there are a lot of people from the state on this call, I'm going to make sure we talk about that after we get off this call.
I
That's
definitely
a
would.
great idea. Thank you.
It was great presentation, and that's the message that needs to be out there to our audience.
Thank you for that. Yeah, but we will definitely be following up with that one.
Thanks.
Okay, here's a really good question. Someone with COVID antibody due to a prior infection, would they need to get vaccinated?
So that one's kind of a definite maybe. So if you currently have COVID disease, okay, so you're just now sick with the virus, we don't want you to be vaccinated because we don't have a lot of information as to what that might do. And we think you should, and we don't want you to come to the vaccine centers and spread the disease around to the people who are vaccinating and observing. We know that with natural disease, you are protected 2 weeks after the natural disease, you're protected for at least 3 months, probably longer. So there probably is there is not an urgency for people who have been recently infected to be vaccinated. Now, let's say you were sick way back in last March. Well, we don't think that your immunity is going to last forever. So in that case, yes, absolutely, you should get the shot as soon as you're eligible. So the Centers for Disease Control and Prevention suggests that you're perfectly reasonable to wait 3 months after you recover from the infection. Now, it doesn't say you have to, but we have a scarce resource here. Why don't we save it for the people who need it the most?
Okay, Marie, I see your hand is up. You want to go ahead and unmute yourself?
Yes, I saw several questions in the chat box related to pregnant women, lactating women, and the effects on the fetus, the developing fetus. Can you both speak to that, please?
Sure. So the vaccine was not tested in pregnant women, but both the ACOG, the group of gynecologists and obstetricians, the American College of Obstetrics and Gynecology, and also the public health people have come out and said, we really feel if a pregnant woman is at risk and she's eligible to get the vaccine, just because she's pregnant is not a reason to withhold the vaccine. And in fact, we do know that pregnancy does increase a woman's risk. This is a messenger RNA vaccine. It does not, there's no reason to think it would cross the placenta or get into the placenta. And there's no reason to think it would be harmful to the developing baby. So if you're pregnant and you're at risk and you're eligible to get the vaccine, absolutely, you should talk to your obstetrician. Always talk to your obstetrician and discuss it with your family, and then, in my opinion, go ahead and get the vaccine. For breastfeeding, there is no reason to stop breastfeeding or to not breastfeed, and there's no concerns that we have about messenger RNA and breastfeeding. Dr. Rogers.
Yeah, the only other thing I would add, Dr. Fisher, is particularly for pregnant women, look at your current situation. So if you're one of these people that can stay home, work remotely, never have to go to the grocery store because you have family members who do that for you, and you're just able to do everything remotely, it's of lesser concern, in my view, to get the vaccine during pregnancy if you're worried. On the other hand, if you drive a bus, for example, or if you work in a situation, or if you work in healthcare, I encourage you to err on the side of taking this vaccine, because as I noted before, we actually are now getting more experience with vaccinating pregnant women, because we know that there are a subset of pregnant women who have gotten the vaccine, and to date there haven't been reports of adverse impact on them. So weigh your own individual risk as you talk to your healthcare provider about whether or not you should get the vaccine as well.
Yeah, the registry is now up to about 18,000 pregnant women who've been immunized, and it doesn't, no safety signals again. One thing that you may have read or looked at on the internet or be concerned about is a thought that the spike protein and the placenta are somehow antigenically related, and that if you're vaccinated, you might make antibodies against the placenta. We don't really have any reason to think that that is the case. And in fact, we know that people who have gotten COVID have not had a problem with fertility later on. So the natural disease certainly doesn't appear to cause any problem with fertility. We have no reason to think that this vaccine will have any effect either. So I think we can be really pretty reassured here.
Great. Brandy, would you mind unmuting yourself and asking your question?
Sure. My question was related to, people being skeptical, or individuals being skeptical about how fast the vaccine was created. But isn't it true that scientists have kind of been working on a vaccine for the virus, but that hasn't really been publicly announced? So it seems like, overnight this vaccine was created, but in actuality, people have been working on something. Scientists have been for a while. You could elaborate.
Thank you so much for bringing that up. When the SARS virus, the first SARS virus came about in 2003, that's when the first messenger RNA vaccines against coronavirus were started. And then it turned out that the epidemic went away by itself, so there wasn't a chance to further test those. But yes, the ideas from a while ago. The other thing to note is that messenger RNA vaccines have also been used for Ebola viruses. So it's not a brand new technology. This is the first one that's going to be very, very widespread use. But it's a technology that's been worked on for over a decade. The other thing that's very important to stress is that all vaccines have to go through 3 phases. And during each one of those phases, safety is the primary thing they look at. So phase 1 studies, small number of people to really work out the right dose of the vaccine. Stage 2 studies, hundreds of people. And in that scenario, you're trying to see, is there any major side effect that we should stop using this? And oh, by the way, does it work? And then phase 3 trials where you have thousands of people. So for the Pfizer vaccine, it's about 40,000. Moderna vaccine, pretty close, about 36,000. And in those, with those larger numbers, that's when you look for other safety side effects and when you can actually figure out, oh, by the way, does the vaccine work? So these are vaccines that are being given to people who are well. So safety is absolutely at the top of the list. A vaccine has to be safe or it will not be released under an emergency use authorization. So I think I really appreciate your bringing up the fact that, first of all, yes, this type of vaccine has been worked on for over a decade, and the trials have allowed us to look at the safety. And as we've already mentioned, those trials are continuing. So we are looking every day to make sure that unusual side effects aren't turning up.
Thank you.
The one request I would ask of my colleagues from the state and from Project ECHO is to find ways to make easily available the video that is embedded in my presentation, because it is a total nerd video, but it is so important in helping all of us understand how science works. It's just wonderful in the sense that you get a sense, you're able to sort of listen to the people who are doing this kind of research day in and day out and actually see how it's done. Part of what's so difficult for us is it all seems so mysterious, and it seems like it's in this black box, and it's like, oh, all of a sudden one day they come up with this mRNA vaccine and we never heard of this before. I really have to emphasize what Dr. Fisher was just saying. We have been working on this technology for over a decade. As a matter of fact, mRNA is also being looked at in terms of, as a method for doing certain cancer treatments. And so this isn't just a technology that's going to be utilized related to COVID, but we're going to be seeing more widespread use of this mRNA technology because it's so innovative and it's going to be so important to us moving forward.
Okay. Let's see, I see a hand up, but I want to ask this one question from Rose. I was asymptomatic in April, tested for 2 antibodies 2 months ago, still had antibodies. I received my second dose a week ago, no symptoms. Can I be a carrier?
We don't think carriage occurs with this virus for any prolonged period of time. So you get the virus stays with you for a bit. Now, the test, though, can stay positive for weeks to months. And the reason is this test to see if you have the virus in your system is exquisitely sensitive. So it will pick up any little bit of the virus that's left. So when you have the disease, you have a lot of virus there and it's very easy to pick it up. But this test is so sensitive that it can continue to pick it up for weeks to months later. I'm not sure I totally answered your question, but I'm not worried that you're a carrier. We know that even if your test stays positive, there's not still a virus that can replicate and make you sick there.
Because I tested in April, I was asymptomatic, no symptoms whatsoever.
Mhm.
Then I did my antibodies in May. So I had antibodies, and then I did it before doing the vaccine. I wanted to check, and I still had antibodies. So when I did the first vaccine back in on Christmas Eve, I didn't have any symptoms. So I'm like, only the sore arm, but that was it for a day. And then a week ago, I got it again on Friday on the 22nd, and I'm still not showing any symptoms. So I'm like worried. I'm like, am I passing this along?
No, you shouldn't worry at all. You're young, you're healthy, you know, your immune system's already worked against this. And what you've probably done is boost those titers up.
Okay.
So, you know, right now, when you get antibody titers, you just get a yes or a no. You don't get the actual value.
Okay.
And those tests aren't generally available, but no, I would not be worried at all.
Oh, okay, because I'm around my elderly parents. That's why I'm a little concerned with that. But thank you. Thank you.
Yep.
Great. Christina, you want to go ahead and unmute yourself and ask your question?
Unfortunately, you're still muted.
Christina, you're muted. It might be because your microphone isn't connected to your Zoom. If you want, you can go ahead and type in your question in the chat.
Okay. All right, Lorena, you want to ask your question? Your hand is up.
Okay, this is something that from the beginning, a lot of people are panicking, and I receive a lot of messages in my group chat about a lot of people, even some in the medical field, believe that this vaccine will make some significant change in your human DNA. How far that is true?
So that is absolutely not true. It's a messenger RNA. It can't change, it can't convert to DNA, and it can't get into your nucleus where your DNA lives. So there's absolutely no evidence that that these vaccines could in any way alter your DNA.
Okay.
I want to reiterate that this question, though, and you're absolutely right. I mean, there are a lot of healthcare providers who have this same sort of misunderstanding, and part of it is that we have to understand that we're living in a society right now where we don't believe facts are really facts. Like, the Earth really is round. Let's all kind of come to that understanding. It really is. Gravity exists. Drop something, it's going to fall on the ground. And so if you understand mRNA, Google it. It actually isn't very stable. mRNA actually goes away pretty quickly after it gets into your body. But the second thing is genetics don't work like that. The science doesn't work like that, and that's where our conversation gets really hard these days, because there's so much craziness out there that it's hard to know what's really true. I mean, sometimes I will Google a question and some answer comes up and I'm like, is that really true? Right. And then I have to go and do a little bit more homework. Right. And so what I also want to urge you to do is, and I saw some of this on the poll, get your information from CDC. Get your information from the New Jersey Department of Health website. Get your information from a website that is either a .gov or a .edu. Some of the .coms are trusted, like Mayo Clinic and Johns Hopkins. But if a website looks a little off, don't necessarily trust it, because we all know that not everything that's out there is for real. And we need to become a little bit more skeptical about some of the mythology that's out there in social media about this disease.
Betty Lee Davis, I see that your hand is raised. If you can just unmute yourself and ask your question, please.
Unmute. Yes. I had trouble finding the link, so I was delayed getting in. So I'll look forward to hearing what I missed of the presentations, the first 40 minutes on recording. And I don't know if anything was addressed in regard to the particular work I do involves going into homes. And we have been doing Zoom until recently, and now we're being required to go back into homes. So I don't know if that has come up specifically among the healthcare providers who are not just in an office setting or hospital setting, but who go from place home to home, if there are particular protections that you all would recommend in those circumstances.
Yes, absolutely. And we didn't really talk about that, but if you're going home to home, you can't really keep that 6 feet away many times. So you really need to make sure that you are wearing a mask at all times, a good fitting mask. There was a question in the chat box about whether you need to double mask. There's no study that looks at one mask versus two masks, but we do know that the more barriers you have, seemingly the better. So if you're more comfortable with two masks, that's fine too. Also cover your eyes. It's very important because if the person is infected and they're making those droplets and those droplets get onto your eyes, that is a way that you can be infected. So some kind of glasses or goggles are part of what you should be wearing. Gloves are important. And depending on what you're doing, having a gown may also be important. So yes, people who are giving healthcare, who are going into people's homes, should absolutely protect themselves, because remember, you're not going to always know whether or not those people are infected or not infected. So you need to keep yourself protected at all times.
We're almost up on time. But
Lisa, can I just add, though, one important thing, which is CHWs are actually in the group that's eligible to get vaccinated.
Absolutely.
So sign up to get the
Yes.
vaccine first and foremost. And the second thing is, I would urge you, if you're going into people's homes, carry, if you at all possible, carry a couple of extra masks with you, because it's important that the people that you're going to see also be masked, because that will help to protect you as well.
Absolutely.
yeah, I was just going to add the CHWs were part of the priority group considered as a healthcare professionals. Some people in this group would have received their vaccinations. Just recognizing that they are the frontline folks who deal with so many families, and really, you know, as much as the vaccine is short in supply right now, and it's difficult to get an appointment. Can you just leave us with some tips, things that they can do as they look to kind of get those communities ready for when there is vaccine or when it is their time to really register and get an appointment? Either of you or both of you, Doctors Fisher and Rogers.
So I think the main thing we'd like you to do is get vaccinated so you protect yourself, and let all of your clients know that you felt it was important to be vaccinated and you really want them to be protected as well, and just encourage them to do that. Everybody should try to get themselves registered. You may not be able to get an appointment very quickly, but at least you'll be registered and you'll be in the system. Dr. Rogers, other thoughts?
The other thing that's critically important is do all of those basic things that we went over earlier. Wear a mask, wash your hands, socially distance. That part of our disease mitigation is not going to go away anytime soon. So the countries that we talked about earlier, New Zealand, Australia, they're still wearing masks. And so, you know, that's going to become part of our natural, you know, you're going to put on your underwear and you're going to put on your mask kind of thing. You know, these are things we all need to wear. So just keeping those things in addition to getting the vaccine, I think is really important.
Okay. Thank you both so very much. You know, a lot of still additional questions in the chat box, which we will get to, and we will feature on a frequently asked questions. So thank you so much, both of you, for spending some time with us and answering our questions. I personally feel much better informed, as do many others on the call. This ECHO session will continue. We have another session next, what's today, Monday? Tuesday? Next Monday, February the 8th, that is really going to talk about social supports using telehealth. So virtual home visiting, virtual support groups. We'll be talking about a lot of that. So I thank you all for joining us today. As you know, you will get a survey that you can answer, and you are automatically registered for the next session if you are here with us today. So thank you again, Dr. Fisher and Dr. Rogers. And thank you everybody for joining us today. Thank you.